Great to have you. I've just gone through your introduction. Your family have got a shout out as well, so I'm sure they'll be very happy. So I look forward to doing the Q&A with you at the end, but firstly you're going to go through digital health first.
Sure, thanks. So thanks for giving me this opportunity. I have some slides. I'm not sure if they're going to be displayed. Yeah. So basically, I'm a co-founder of WebDoctor and Newer Solutions. Interestingly, Professor Curley mentioned the resistance to change in accepting technology in medicine. And I used this picture to soften up the audience when I was talking to clinicians to show that it was human after all, because we experienced great friction and great resistance to change when we first launched our telemedicine services. And to give you an idea, as a business, we power basically software platforms that enable telecare, like WebDoctor, like Care on Call, and like Has Health. We actually provide the clinical services as well for WebDoctor and Care on Call. So we've built our platform and built our software based on what's actually needed in the real world, and we've done that over the last 7 years. In terms of the problem that we originally tried to fix, today most EHRs and most systems that record patient data, really, and digital data are effectively digital filing cabinets. They don't make any improvements in the performance in terms of the efficiency or the safety of the patients that are stored there. And as another example, the script that you see there on the right-hand side is actually a real prescription presented to a pharmacist, and it's literally impossible to ascertain what is actually on the script. So there are some real issues with the platforms that clinicians have to use today, and we decided to take a data-driven approach. We wanted to optimize clinical communication. We wanted to enable telecare and care, basically. We set ourselves audacious goals of be 10 times more efficient than the existing systems. We tried to capture more data to make sure that the data that we captured was structured, that it was secure, in the same level of security that banks and telecoms would have used for their systems. And last and most importantly, we wanted to bring the software to the patient and make our platforms truly patient-centric. And because for ourselves, the democratization of the patient's data is what enables progress and enables all these efficiencies. We believe the patient owns their data, they control it. And as a result, basically, we allow the patient to contribute in new ways. So the title of this talk is Digital First Health. And for our systems, all patients will book and apply and engage with clinicians first through digital means. And this was completely different how things were done pre-COVID. Generally, you would deal with an appointment with your GP or your clinician. You would book an appointment over the telephone or in person, and you would go and see them face to face. Today, COVID has changed that, and everybody is now digital first. Everybody is now working on telephone screeners and digital screeners before they see their clinicians in person, if they do at all. And our goal really on this was really to make it easy to do the right thing and make it hard to make mistakes. Our progress to date basically is that we launched, as I mentioned, in 2016, a telemedicine service called WebDoctor.ie. We launched it in just the end of November. We basically built that service and deployed that clinical service because we knew nobody would be interested in licensing our software unless we were able to prove and show that it was there was a demand for it, and that it was safe, and that it worked, etc., and it was efficient. We quickly won the Leia Healthcare deal in terms of we provide the Leia Healthcare's Care on Call platform. And we then worked on licensing that software out to the market and to other providers, both here in Ireland and across Europe. Finally, I think this is something that Professor Curley mentioned. We started to expose and offer this software to smaller clinic groups and clinics and clinicians themselves, and that's our Has Health offering. And that progress has taken us through the number of years, but there's been a huge acceleration in the last 12 months. So I'm a great fan of Randy Pausch, who's a Carnegie Mellon computer science lecturer who passed away a number of years ago. And he has lots of kind of famous sayings. And one of his sayings is, when there's an elephant in the room, introduce them. And for me, when it comes to digital first and data, the elephant in the room is GDPR. And basically, GDPR gives the patient certain rights and certain privileges, and one of them is portability. You're entitled as a patient to have a structured, commonly used and machine-readable format of your data, not just from a clinician, but from any provider that stores your data. We took that to a new level, and there are existing systems and technologies to enable that type of share. And we basically wanted to ensure that the patient was at the center of this. And in our case, we basically looked at something called Open Notes. And Open Notes basically is it's a campaign, and it's basically a developing process, I guess. I think it's describe it, that's worldwide. Started in Israel and in the US, where patients get full access to their clinical notes. And as part of that, there are things that basically that improve healthcare. There are things there that empower the patient, and I'd like to give you some examples of why. So first of all, people are just too busy to do everything they're supposed to do. So we find that basically when a patient is given a set of tasks to complete by their clinician, they'll typically remember a couple of them and they'll forget one or two, and that's just one of the examples. Another one is that people don't always look at the instructions and read the instructions and do what they're told. So they need a place that they can return to find out what was the advice that was given by their clinician. And lastly, and most importantly, people make mistakes. There's a fantastic study here, which I'm happy to share the links of, where over 135,000 patients were surveyed, and 1 in 5 who looked at the notes that were recorded about them and about their consultations noted what they perceived as a serious mistake in the notes provided or completed by their clinicians. And when you look at the paper and you see the most common issues were mistakes in diagnosis, medical history, medications, the physical exam results, the test results, sometimes the notes were on the wrong patient, and sadness. And it's worth mentioning here that Dr. Sylvester Mooney, our clinical director, would always say that when it comes to medicine, 85% of any diagnosis is based on the information, on the history, on the recording of a good, solid history. So that's the end of my slides, and that's really just an overview of what we've done, and I hope that gives people a flavour of things.
That's great, Oisin. Thank you very much.